Good evening, everyone. Thank you, Janice, Joey, and Google for inviting me to this event. It's a privilege to be here. Today, I'll share about how MyDoc cures your fear with Google Cloud Platform. Let me give a quick introduction to MyDoc. We are a Singapore-based, homegrown digital healthcare provider. We provide an integrated online to offline healthcare ecosystem. What this means is that our users start the whole experience on our apps on Android, iOS, and web, while they can consult a doctor through video calls, and if required, they can be referred further to a clinic or specialist or even to the hospital, right, to continue the consultation. What's great about this is the whole process starts online, especially relevant during this current circuit breaker period in Singapore. You do not need to step out of your house and you can consult a doctor. We are also very honored to be awarded recently the 2020 Singapore Telehealth Company of the Year by Frost & Sullivan. It's a great honor. How is MyDoc helping with the COVID-19 situation? On 14th of February 2020, this year, on Valentine's Day, we launched the COVID-19 clinic. Right? Initially, it started as a local public service campaign in Singapore only, but we have received a lot of interest from countries around the region, and we have since then expanded it to other countries in the world. So this has become a global public service campaign to cure your fear. How is this possible? This is largely thanks to sponsorship from our employees, our friends, and our corporate partners. Thank you so much for your support. What is the COVID-19 clinic? This is a triage assessment service that is created specifically in response to the COVID-19 outbreak. At around late January and February this year, right, there's a lot of fear that's rising, and there's still a certain amount of fear nowadays about what is COVID-19. Where if I have symptoms like slight flu symptoms, if I'm running a fever, do I have COVID-19? So MyDoc, we started this service online so that users and patients can consult doctors in a safe environment to cure their fears, to address their biggest concerns. So we have a dedicated team of Singapore licensed doctors who are highly respected in the world, who will assess your risk, assess your concern, and help allay your fears over flu-like symptoms. We are also in a regulatory sandbox with the Singapore Ministry of Health. So MOH has very strict guidelines around patient safety and welfare. So being in the sandbox with them, right, gives you further assurance about your health and safety. Who is eligible to use it? Anyone who may have respiratory flu symptoms or has concerns that they would like to address regarding the COVID-19 virus, you can use our clinic. The clinic is ready to provide timely triage assessments to alleviate any worries that may stem from misinformation. Well, especially currently online, there can be a significant amount of misinformation and fake news. And we want to help to reduce this and also help with solving and reducing the general panic associated with COVID-19. Okay, so let's get started. I'm going to pause at this slide for a while. So if you want, you can use your phone or point your phone camera or your barcode scanner at the QR code on the screen. Right? This will redirect you to this URL, join.md for MyDoc /COVID-19. This will bring you to the landing page where you can join the COVID-19 clinic. I'll pause for a few more seconds in case you need more time to bring out your phone to scan the QR code. Okay. After scanning the QR code, you'll reach the landing page where if you already have a MyDoc account, you can sign in, or if you do not, you can create an account immediately, and then you can sign in, and there will be a list of public groups for you to join. One of these public groups is the COVID-19 clinic group. Join it by clicking it, and you can start scheduling a video consult with a Singapore licensed doctor. So here we have an example of what a video consultation on your phone looks like. Over here, we have a patient who's talking to one of our doctors. He looks really reassuring. reassured already that I'm fine. So yeah, so take the opportunity to sign up and start scheduling appointments with our doctors. I do want to highlight, especially during this period, our doctors are heavily overloaded, right? So please be patient with us if you need to wait for some time before to get scheduled with a doctor. Please bear with us in the meantime. More information about this COVID-19 clinic. It is provided by Singapore-based doctors and is open daily from 8 a.m. to 10 p.m. Singapore time. The assessments are conducted mainly in English with limited availability in Chinese, Malay, Thai, and Vietnamese. The details will be requested during your first consultation and viewable only by the healthcare professionals attending to you on MyDoc. What happens if a patient shows COVID-19 symptoms? During the assessment, you will be evaluated based on the risk of being infected with COVID-19, and you will be advised on precautionary measures. If a patient is determined to meet any case suspect criteria or is suffering from any moderate to severe symptoms, they will be triaged into a higher risk category. And the follow-up action will include going to a hospital or clinic in person. What other services does MyDoc provide? We offer a 24/7 medical triage service to assess your health condition. You can schedule an appointment at any time of the day. We offer 24-hour online GP consultations, and we also provide digital prescriptions, medical certificates, and specialist referrals. Next, I'm going to share about how MyDoc scales with Google Cloud Platform. We operate in 8 countries in the region, and we are still expanding globally. Google has been a great partner to us, and we are a big fan of Google Cloud Platform because ever since we switched to GCP, it has enabled us to scale very seamlessly and expand to many different regions in the world very easily. An overview of how we use GCP, our core administration applications, authentication, communication, and static image services are all hosted on GCP. We use GKE, Google Kubernetes Engine, to deploy, scale, and manage our applications in containerized environments. We also use Google Stackdriver, which is great. It's very powerful. It has very powerful monitoring, logging, and diagnostic features. It enables us to scale with confidence. This is a simplified overview of how we use GCP and all its components. So on the left, we have all our apps on the different platforms, Android, iOS, and web. And there's a variety of services that we use. Cloud DNS is great. Google DNS is one of the most resilient services in the world. Well, sometimes when we encounter any DNS outage, one of the first advice is to switch to use Google DNS. That shows how resilient and reliable Google's Cloud DNS is. We use cloud load balancing. Well, it comes with really dynamic load balancing features where, coupled with GKE Google Kubernetes Engine, it allows us to load balance and auto scale very effectively. We also use Cloud IAM. This provides enterprise-grade access control management, which is very, very important in a very complex infrastructure environment like ours. We use Google Cloud Storage extensively. We generate a significant number of documents, e-prescriptions, referrals, and all these are stored securely on Google Cloud Storage. We have a significant number of nodes on Google Compute Engine, and coupled again with GKE allows us to auto scale very effective to serve multiple markets around the world. GKE, it supports fast rolling deployments with zero downtime, which has been very effective for us. Previously, before we switched the provider, we had to suffer up to 2 hours of downtime. Today, with GKE, there's zero downtime when we do rolling deployments. Our Kubernetes clusters are also deployed close to groups of users around the world to minimize latency. For example, well, we have users in Hong Kong, for example, right? Those clusters will be deployed in the regions as close to them as possible. Auto-scaling pods, so we set it to be based on 80% CPU utilization. So whenever they exceed that CPU utilization, additional pods will be added, right, to support the workload. Cloud load balancing. So it has a globally balanced IP addresses, well, for all our internet facing services, and data is routed to the nearest region, reducing the latency to our users. We have achieved great results by using Google Cloud Platform. We have observed increased API speed by 7-fold compared to our previous cloud environment. We have gained the ability to deliver updates without downtime, which is great for a 24/7 service like MyDoc. We have also achieved pricing flexibility to support cost-effective scaling. Thanks. Back to you, Joey and Janice.
Thank you so much, Ren, for flying the flag for Singaporean startups. Love it. So we have questions from the audience. I thought I'll merge this one because from the same person, if you can help to answer that. So the question is MyDoc under Smart Nation roadmap? And is there features like anonymous rating for different assessments?
Currently, we are still assessing our roadmap. So no, we have not worked with a Smart Nation roadmap. But in terms of sharing data, no, we do not share patient data with MOH. Yeah.
So how does it help in identifying potential cases?
So this is actually, I'm not necessarily qualified to answer this question from the medical angle because I'm not a doctor. So it depends on during the video consultation process. The doctor will ask about symptoms, will ask about how is the patient, what kind of recent travel history and contact do they have, and they will use their medical knowledge to do a triage assessment. If needed, they will advise the patient to go to a clinic and hospital for a follow-up.